So I never, ever, ever imagined in my life that I'd be opening my own practice. And then the straw that broke the camel's back was just like, they were like, yep, you won't be able to take Christmas off because there's four of you and only one of you can be off. And like time with my family is so important. That is like where I drew the line. I came home that night and I was like,
Mhm.
that's it. I have to leave this job. I can't take it anymore. So here we are, jumping off the cliff. We're ready to go.
Welcome to DPC Life, the podcast where independent doctors share real stories, bold ideas, and the freedom of doing medicine on your own terms. I'm your host, Dr. Ann Gonzalez, and together we'll explore the wins, the struggles, and everything in between. Let's dive in. Welcome back to DPC Life, the podcast where we talk about all things DPC and life beyond the office. And my guest today is Dr. Sandra Koehn. She is an internal medicine doctor who is getting ready to open her DPC, Planted DPC in Rochester, New York, in just a couple of months. Together, we talk about boundaries, talk about the ideal patient that she'd like to see, access to care, and how to build a DPC practice that helps both her patients and fits her own life. But before we dive in, if you are a woman in DPC, or you're about to open your DPC and you're feeling a little bit stuck, scattered, or feeling alone in your journey, I'm hosting a small in-person event in Hickory, North Carolina next month called DPC Women Connect. It's capped at 15 women and designed for connection and support and not information overload. We want to provide a community to support you that you can come to when you need answers and just need someone to listen to and maybe a little bit of guidance. So you can find the details in the show notes below. So let's get into the episode with Dr. Sandra Koehn. So today my guest is Dr. Sandra Koehn. She is a direct primary care physician, or about to be, right?
About to be,
Direct
yeah.
primary care physician in Rochester, New York, and her DPC is called Planted DPC. So welcome.
Thank you. Thanks for having me on. I'm very excited.
Absolutely. I'm glad to have you on. So let's start out. Tell us more about how you got into DPC and what you were looking for when you came to DPC.
Yeah, so I never, ever, ever imagined in my life that I'd be opening my own practice. To me, I don't have a business sense. This is not a thing I want to do. I just want to go take care of patients, come home, and like leave work at the job. And so, yeah, it was never anything on my radar. The first time I heard about DPC was probably around 2020. My husband, who's also a physician, and I knew a couple in residency who opened a DPC together out in Michigan. And so that was the first time I'd ever heard of it. And we kind of looked into it briefly and we were like, what is this crazy direct care thing? Like, it was like too much for us at the time. We're like, kind of sounds nice to be your own boss, but this is just not, no, our job's okay. We're surviving. It's fine. Not for us. And then I think after the pandemic, I've been an employed physician for about 7 years. And when I first signed on, it was all of our higher administration was all physicians. It was really physician friendly. There were a lot of just the way they treated us just really was what kind of drew us to move to Rochester, where we like don't have any family. I mean, we came here just like for this job basically. And just since COVID, just the whole upper administration framework has completely shifted, out with the old, in with the new, and it's just been such a massive overhaul that it's just become so corporate. And just over the last several years, we've just seen our autonomy just dwindle and micromanagement kind of increase. And they're like becoming very just trying to kind of squeeze blood from a stone. Every little, like, you're 15 minutes short on your contact hours. You got to add like an appointment here. You can't block this. Or your lunch now doesn't count towards your hours, where it's like, who even has lunch? We're seeing patients. Like, no. And
Mm-hmm.
so, yeah, I think it's funny. And then the straw that broke the camel's back, which there had been like a few things in a row where like they told me I couldn't have a med student and because we were too busy. I was like, you're telling me I'm too, wait, what? But no, yeah. So, and then the straw that broke the camel's back was just like, they were like, yep, you won't be able to take Christmas off because there's four of you and only one of you can be off. And I have three very small children and my husband like works every other Christmas holiday. And I'm like, well, the perk of staying where I was is between the other doc and I, we were pretty good. I would take Christmas every year. She'd take Thanksgiving every year. And it like worked out really well. And I had thought about transferring to a different office within the organization. But that was like the thing. They were like, you might not be able to get all the holidays you want off because everybody else has got little kids too. And so it was kind of like, all right, I'll just stay. And then all of a sudden everything changed. And nope, you can't have the holiday off. And no, you can't have this time off. And like time with my family is so important. That is like where I drew the line. I came home that night and I was like, that's it. I have to leave this job. I can't take it anymore. We got to find some different way because that's it. So we kind of talked about it, and my sweet husband is very supportive. And he's like, okay, well, let's look into this whole direct care thing again. Yeah. And then I don't know, just for whatever reason, this time we looked at it more seriously and kind of started reaching out to local DPCs, which we have a handful of them now in the Rochester area. And just the more we like dove into it and the more we learned about it, I was like, oh my gosh, this is the thing. Like, this is the calling. This is what I want. And so, yeah, so here we are jumping off the cliff. We're ready to go.
Yeah. It is like jumping off a cliff, but it's all good. It's all good.
Yeah.
So your practice that you're out now, correct? You're done with your employed?
No, I'm still actually
No?
there. I have given my notice. So my last day, so I'm working through the end of February.
So let's see, do you have a non-compete?
Yes. So I do. I've got like a 10-mile non-compete, which is fine because I work like 20 miles from where we live. So it'll actually work out. So I've got a location already, which is like a little room
Great.
that I'm going to be renting like month to month.
Perfect.
And yeah, and then I do have a 1-year non-solicit, which I think most contracts have that maybe. I don't know. And so I'm not like technically able to tell anybody like where I'm going or what I'm doing and it's just super awkward because patients are rescheduled. They're like, okay, well, I'll see you in 3 months. And then they go out and they're like, well, why are we scheduled with the NP? I'll be like, well, she's not here that day. Well, then we'll just wait till she comes back. And like, it's just like super awkward. It's so weird.
Never coming back.
No, I don't know. I don't know what they're doing. I'm just like, okay, you don't want me to say anything. I'm not going to say anything, but this is making y'all look bad. No, how do you want us to respond?
So they haven't told your patients?
No,
they haven't really told them?
When I was kind of like, hey, people are asking, what do you want us to say? They're like, well, we're planning on sending a letter 30 to 60 days prior to your last day. I'm like, well, that's
still a while.
It's going to be, yeah. So I don't know. So I'm like, okay. But I mean, I have a landing page, which I've been kind of working on. So since I decided to do this DPC thing before I even put in my notice, I created a landing page. I was kind of just doing like a blog, and it was just, health resources. I kind of just framed it as like health resources for my patients. And so if I had a patient coming in, we're talking about nutrition, or they have hypertension or diabetes, and we're talking about, I'll say, hey, check out this. It's all the stuff we just talked about. But if you forget everything I just said, it's all
that's great
in there. And so I've had patients kind of looking at that. And so I was kind of like, I had a QR code and I was like, hey, look, check this out. And then I had a patient come in just a week or two ago and she said, hey, I was just looking you up and I found this like page. She found it on her own. And I was like,
perfect.
That's so exciting. So I know people will find it. And so I'm hoping once the news is out there and I can actually be open and talk about it, that I'll put something on there, or maybe even forward that to my website, my clinic website once it's launched.
Yeah, perfect. Yeah. Do you have a sign up to get emails on your blog?
So I kind of tried to do that, and I am having trouble with the techie part of it. Like, just like I can't get it to work. Initially, I did have that, and it was like sending. I wanted to set it up so it would send like a welcome email or something, or an alert, but then the automation thing wasn't working, and it was going to spam, and like it. And I was kind of just, I'm doing so much other stuff right now. I just don't have the bandwidth to figure this out. So I kind of just aborted mission with that. A little bit.
Well, you could do it the old-fashioned way and just have them write their email down and say, hey, I've got this newsletter or this blog where the stuff we just talked about, I
So they
can
like
add
physically
you to
just
the list.
writing their email.
Yeah,
down,
you're not
like,
soliciting
for
them.
me. Oh, okay.
You're just getting information for an email.
Yeah. Okay. Oh, that's
and then,
very simple. I could do that. I can handle that.
You can do this. You got this. You got through medical school and residency. You got this.
I feel like I'm at a point now where like initially it was all just the medicine part of it was so overwhelming. And I was like, I can't even handle thinking about like a business thing too. Like I'm just trying to learn the medicine of it all. I mean, not to say I don't, there's lots of things I still don't know, but I'm more comfortable with all the medicine piece of it. And so I'm like, okay, now what? So this
Yeah.
has been really
Yeah.
like exciting. Like I'm so like
It
energized
is.
and so excited. I'm learning all sorts of new things I like never really honestly had an interest in.
Well, good. Yeah, that's great. Some people do it and they really don't enjoy the business part. I mean, they're like, well, they have to do it, so they do it. But it is a lot easier if you do like it.
The marketing stuff is really cool, but I don't know, like the financial thing is still not like my thing, but I haven't gotten super into that yet. But it's been fun, just like learning new things, and just being like being creative and just like creating something is just really
Right.
really fun.
Yeah. Yeah. I think that's one thing that a lot of business owners and physicians that are entrepreneurs as well, they realize that they are creative people and there's really not a great outlet for that within medicine
Yeah.
itself. People do stuff outside of medicine, but then this way it is creating. You're creating your own business. You're creating what your dream. So it is very much creative. Well, let's see. What would you like to focus on? So after we talk, after the end of this session, what would make it successful for you if you had walked away with some kind of plan?
So I have two or three kind of areas. So one is a smaller, maybe quick, uh, like what's your opinion type of question. So I'm a DO and I do osteopathic manipulative medicine, and I do some of that in my current employed job now, but not, I don't really advertise it because it's just time consuming and I just honestly can't do a lot of it. But I'm really hoping to incorporate that within my DPC. And so I've gone back and forth a lot on should it just be something for members or should it be something that I offer for non-members as potentially like a way to get them in the door. I'm sort of leaning towards that option, and there really are not a lot of other osteopaths in the area that do this, so I think there is a market for it. And so I was thinking of offering OMM to non-members at just like a per treatment price, and then they can have a much discounted rate if you are a member and you do want some OMM treatment. So I don't know kind of what your thoughts on that.
Yeah, I think that's something, especially for people who are starting out. Several docs that I know have used that as kind of their initial draw for patients. And they'll start out with non members. And just like you said, say, for example, it's 150 for a non member, it's 125 for a member. So you're not undervaluing it. You're not going to completely cut it to $60, but there is a benefit to being a member. I have talked with one physician who said he was doing a lot of it, but he cut back because he realized he was like, you know what, my hands. I had a hard time doing all the
Every day.
OMT. I was actually getting very tired. So
Yeah.
he was doing a lot more, but once he got busier, he kind of slowed down on it because just physically it was difficult. But yeah, I think it's a great thing to be able to offer, and it is definitely different. I think DOs are it's they don't get a chance to do OMT a whole lot just within the system
Right.
because everything is so time crunched.
Yeah.
You need time to do that. And there really isn't any chance to. So
Hmm.
if you enjoyed the OMT, which it sounds like you do, this is great. You
Yeah.
get to bring back those skills. You got to use them.
Awesome. So you said something about not undervaluing it. So I was thinking of doing 150 for a non-member. I was actually going to do like 50 for a member. Is that just too low?
I
I guess
mean,
I was kind of trying to, with if you have the membership plus that, like I wanted to make it so that it's almost a no-brainer to like just do the membership. But I don't know.
yeah. Yeah, no, I think there's definitely a point to that. If you do it at 40 or 50, you're going to have a lot. And
Mm,
depends on what you want. If you want more, then keep it lower. If you don't
hmm.
want as much, but you want some,
Okay.
I keep it
Maybe
a
a
little
little bit
higher.
higher. That is helpful. So my other question is, well, my big question is about my patient, the ideal patient. That question just always gets me because I'm like, I like all sorts of people. So I've had a hard time narrowing it down. And I think they do tend to be more women, but I have a lot of male patients that I also like enjoy interacting with and treating. They tend to be sort of in the kind of younger to like middle age, like maybe 30s, 40s, maybe 50s too. And typically, just busy professionals have a lot of demands on their time. They're taking care of their kids. Maybe they're taking care of aging parents. They're working a full-time or part-time job.
Well, it is hard. I mean, primary care is not specialized, obviously. I mean, that's the complete opposite of it. So it is hard to pick one, of course. But you enjoy relationship medicine. It's very obvious. You like the relationships with your patients. And I think I mentioned in an email, I said, well, who's your favorite patient? Think of who your favorite patient is, or like a couple different favorite patients that you like to see. When you see their name on your schedule, you're like, yes, I'm going to see so and so today.
Okay.
I'm excited about that. As opposed to some people, you look at the schedule and you're just like, oh, sad.
Before I go in there, yeah.
So, who is that one or two people that you enjoy seeing? And then what is it about them that you enjoy? Why do you enjoy seeing them? And then most of the time, though, it is, like you said, mostly women and the people that are kind of similar to your age. That's who
There's
most
a
people enjoy
connection
seeing
there.
anyway.
Yeah.
Right. Yeah. Because if someone is 70, they really don't love seeing a 30-year-old who just got out of residency, right? But yeah. Which is fair. I mean, some do. You do build better connections with people that you can empathize with. So I mean, that makes sense. And then as you continue in your career, your patients kind of age with you. It's just pretty typical. But yeah. So what would you say? What are the
Okay.
people, those people that you like, those favorite patients?
Okay. I would say in like early 40s. I'm like thinking of a person in particular who she is a therapist. She owns her own therapy kind of business. Her husband sees me as well, and he's in education. They have two younger kids, not like super young. They're like school age children doing like a lot of sports and that kind of thing. I think I enjoy seeing her just because we just kind of have a rapport. I think we're very kind of comfortable talking about just all things, not just medicine, but like how is life going and all of that, all the family dynamics and everything. And just kind of health conscious. Like she wants to stay healthy but there's a fine line there because when it gets to be like too much, well, it can sometimes be a lot where they want a lot of different things that are maybe not super evidence based or when that's not the person. So that can go wrong very quickly. But I don't know. I think I actually realized I like seeing patients who have not like debilitating anxiety. That can be really kind of frustrating if you keep trying to help them and nothing's working. But I do kind of like seeing patients that are like super overwhelmed and they're very busy and they're not sleeping and doing some stress management stuff with them and helping like with some anxiety, maybe with medication or therapy or some other kind of lifestyle things. And then just seeing those people back and seeing them improve. And they're just always so grateful. And I love that. I think that's super rewarding. But I also have these like super cute old ladies that I love seeing too. I mean, but I think it's mostly like you said, people that are similar kind of stage in life as I am.
Okay. I mean, yes, we like seeing. That's why we went into primary care. We like seeing the spectrum. So think about the therapist that you were just talking about. And so where does she hang out? Does she go to the gym? Does she have elementary school kids? Does she shop at Target? What does she do? And where would you be able to find other people like her? Mm-hmm.
Okay. So trying to find some of those answers so that you can
Yeah. And it doesn't have to be a real person. I mean, you don't have to base it on her particularly, but you can say, okay, yeah, so my ideal patient is in her 40s. Her kids are like in elementary and maybe middle school. They're real busy. They got soccer and baseball, and she's traveling all over the place, and she is working too. And her parents are getting a little older, so she's taking care of them too. And so then you kind of figure out, well, where does she go? What kind of circles? And then where can you meet people like her?
Okay. So then once you do kind of hone in on your perfect patient, then what's like the next step in that progression. So yes, let's say she likes to go to Starbucks every day and she travels for soccer. And so she's
Mm-hmm.
very busy and does a lot of, I don't know,
Right.
Instacarting. I don't know.
Yeah. So then try and think about, okay, put yourself in her position. What are her pain points regarding medicine, the health system? Is it access? Is it the short visits? Really is difficult for her.
Mm-hmm.
Is she not seeing her same, is she not getting to see her doctor because say you're booked out 2 months? Is she
Right.
getting short visits because again, you're seeing 30 people a day? Is she
Yeah.
not going to have the time to discuss what she needs to discuss?
Mm-hmm.
Is there time to talk about mental health the way that you want to address it?
Right.
So, kind of putting yourself in her place. I mean, you can, and you can even ask your patients now, if there was an ideal practice,
What would it look like?
what would you want?
Yeah.
Yeah.
So I'm part of our local kind of moms group for our little town. And
Mm-hmm.
and anytime kind of something medical comes up, I'll kind of just, hey, I like PCP.
Sure.
Here's what I think. Maybe talk to your doctor. Good, whatever. And so I put out like this poll once, just what I'm a primary care doc in the community. What about our system? Like, what about the healthcare system is like the most frustrating for you? What irks you? What would you want to change? And I was amazed at actually the responses. Like there were, I think there were like 100 people who commented on it, which was like
Wow.
wild. So and they were all like, thank you for asking. They were just so like
Yeah.
grateful that somebody was actually asking them what they think, which was really surprising to me. But by and large, I would say 80 to 90% of people struggled with access. It was just access, access, access. I mean, there were other things here and there, but that was the
Mm-hmm.
one kind of main thing that just kind of kept coming up. And so that after I did that, I sort of reframed, like I went back and because I was working on my website at the time, and I sort of went back and changed some things to really try to bring out that to kind of address that pain point the most.
A great idea to do the poll. Absolutely.
So that was super helpful. But yeah, I think a lot of patients in our particular area just really struggle to get in to see their doctor or even to get to
Mm-hmm.
have an established care with a primary care doc.
Yeah. Could take 6 months
Mm-hmm.
to get in. And
Yeah.
then I've had this happen to patients before. They wait 6 months. By the time they get there, the doctor they were going to see is
Is
gone.
leaving, yes.
So
Oh
they
my
have to see
gosh.
someone else.
Oh,
Isn't that
it's
terrible?
so sad. Or they see them one time and then they're
I know, and
gone.
then they're gone. Oh,
Yeah,
it's terrible.
it
Yeah.
is. It is.
Yeah. But that's really a great idea. So those people who did respond to you, if you know any of them and you feel comfortable talking with them, you can reach back out to them and say, "Hey, you answered my poll. Can I pick your brain?"
Mm-hmm. Okay.
And odds are, if they're responding to your poll, they're pretty irked about something. Something they've got a bone to pick about something. So
Yeah.
reaching back out to them and just kind of getting a feel, and then you can start saying, I mean, if you're allowed to say stuff, talk about the DPC. Just kind of start putting that bug in their ear because some of these people could help spread the word for you.
That
And the groups
idea.
can be really helpful because if you can find a couple people who are either your patients or you know them and they can vouch for you, because there's always somebody on those groups. Hey, who's a good doctor? My doctor doesn't listen. I mean, it's every day there's something on these groups. Then whoever can say, well,
Yeah.
what about Dr. Koehn? Well, she's
Right.
got a new practice. She's taking patients. And especially if they are your patient, then that's really nice because then they can talk talk about the practice
Yeah.
and say what they like about it.
Yeah.
So the groups are great. So and then also if somebody asks a question, certainly you don't want to give medical
Right.
advice. You can just kind of educate. Say, I'm a physician. I'm a practicing physician. Da 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 da. I mean, no medical advice, of course. But then, if you're interested in coming to see me, a lot of them you can't just put out like an advertising or promotional post.
Right.
But you can, if someone asks a question, generally it's okay
To
at that
answer
point to
that.
say,
Yeah.
I have a practice. Yeah.
Okay. Okay.
But yeah, just check the rules of the groups. You don't want to
Yeah.
get booted
Yeah.
out.
Yeah.
But generally, that seems to be how most of them are.
Yeah. Okay. Okay. My next question for you is about boundaries. Um, I think it was you had done an episode on boundaries maybe, I think.
Yeah, with Dr. Cook.
Yes.
Yes.
And so I was like, oh man, I need those so bad. Just even start, I haven't even launched my DPC yet. And I'm already like thinking about it like at all hours of the day and night. And I listened to that episode and I was like, oh yeah, I need this. And so I really like, and you've said this a few times, and I love your podcast, by the way. I've listened to all your episodes so far,
Oh, you're
but
so sweet.
no, it's so good. And that's why when I saw you're like, anybody want, I was like, yes, me, pick me.
Aww.
So just like the starting how you want to finish, that like really spoke to me. I love that because I was like, oh yeah, I'll have so much time. But you're right. Then you set this precedent and then you can't keep that up. And so I guess I'm not really sure exactly what my question is. I still want to be able to like have time for my kids. Like I have to, drop them off, pick them up from the bus. My kids are like 7, 5, and 2. So they're a lot. After 3:34, when everybody's home and I'm like juggling all of that stuff, it would be difficult at that time to be answering patient calls and having a long discussion over the phone with someone. And so I guess I'm not sure how, in my mind, I'm kind of like part of our value, how I see the value proposition of DPC is we're available whenever you need us. And so I'm having a hard time like bringing that with, well, I can't really talk to you after 4, like, unless you like really need me. So how do you do that? Is that fair? Will patients kind of scoff at that and say, well, why am I paying if you're not available at all hours of the day and night? I don't know what your experience has been or any advice you can lend to that.
Yeah, it's tough. And there are a lot of women in similar situations. Very young children, they work part-time because they are the main caregivers for their children. And so it just goes back to you got to start the way you want to finish. So you go in with having kind of the expectations, going through those expectations with your patients so that they understand I am a mom. I'm a mom first, right? And my family will always come first. Not that I don't care about you, but yes, like they come first. And so there will be times where I might not be able to see you. I might have to reschedule because my little one's sick or I have to pick them up after school. So if you start out by telling people, this is how it is, I'm in the office Monday, Tuesday, Thursday from 9 to 3 or whatever your schedule is, then if they're your people, they will respect that boundary and they will understand when you say, I can or I can't do this. You have to set the expectations up front. I mean, you're there to serve them, yes, but you also want to protect your time, protect your time with your family. So the boundaries, it is hard. And one thing, I think it was at one of the DPC summits, maybe Dr. Clodagh Ryan, she was giving a talk about boundaries, and she was saying that if there's something that's happening and you are starting to feel resentful, oh my gosh, that patient called again, I can't believe it. There's a boundary being crossed, and you need to figure out, maybe you don't even know what boundary it is, but if it's getting on your nerves, something's happening, and you need to kind of backtrack and figure out, well, is this something that I've told them not to do? Because if it is, then they've definitely crossed a boundary. But if you haven't said anything about it before, well, then that's on you. You need to clarify with them, this is not acceptable.
Yeah.
This is not how it works.
Yeah.
So
It's like
it's also
test.
about
Sensing.
how do you feel about that? Because there will be times where you're like, oh my gosh, I can't believe that they're asking for this again. And sometimes it's because we hadn't said, this is what you need to do, or this is how it works. And so we just then we know, okay, we need to add that to our list of like, if this happens, this is what you do.
Coming back to boundaries, is it unheard of? So I have friends who they're like, you're on call. What? My doctor doesn't take calls like on weekends. I'm like, is that a thing? Are there clinics?
I didn't think you could do that.
I didn't think you could do that. So I was going to ask you. Can I just be like,
there has to be somebody
can I just be like,
on
on Sundays,
I'm
not going to answer the phone. So get your things needed, whatever you need. And if you need to go to urgent care, then go to urgent care. You can wait for me on Monday. Like, is that like too much of a bad? Can you do that? I don't know.
For some reason, I'm thinking that you have to have at least something all the time. I'm not sure why that's in my head. But when you think about access, You can have certainly phone, you can have text, you can have portal. So if you have, I mean, you can certainly say, I'm not answering just routines. I'm not doing your refill
Mm-hmm.
on a Saturday because you forgot. That's one of the
Yeah.
things we say. Please don't wait until the weekend. If you need an appointment, don't call me on Sunday morning. Let's do that on Monday. So you can say, please, I will answer urgent calls on the weekends. And generally, I'll say it's not very often.
Okay.
I think patients, they like to know that you're there for them. And some people have this situation where people are calling, and it's just, they just need to know that you're there for them. They're not going to get ghosted. When they need you, you will be there. And then they start to calm down. But yeah, I think definitely still saying, I will answer your calls. If it's something, and we'd use the portal for this a lot. So if it's something that's not urgent, please just put it in the portal. And again, like that way, I don't see it and obsess about it.
Yeah.
The thing is, it's very freeing because you're the boss and you can kind of make the rules, right? I mean, not kind of, you can. Yeah, these are your rules.
Right.
These are your rules. So a lot of times, just like you're saying, do people do that? I mean, you don't have to get permission from anyone because you're the boss.
Yeah.
Then you can design your practice the way you want it.
Right. Yeah. I know we're kind of running a little bit short on time, but my last question is, so here in New York, we have a lot of DPC is complicated out here. It's not as
Yeah, I've heard.
simple. Unfortunately, we can't do like in-house dispensing. Can't. It's all patient-direct billing for labs, so we can't do client-billed labs. So we can't offer the $3 A1C that I would so much love to offer. It's just so infuriating, and so I struggle a little bit to. I just feel like it takes away some of that value of how great DPC can be. Like it just kind of, it just feels like it takes away something. And so how do I still kind of offer value and not sell DPC, but like, how do I promote DPC? And when two of these really kind of big benefits that a lot of people might read about are not really applicable here in our state.
Yeah. Well, remember, most people don't know what DPC is anyway.
That's true.
So they may not know
Yeah.
that they could get client bill labs or, in-house dispensing meds. They may not even know that.
Yeah. That's
So
true.
it may be a non-issue.
It might. Yeah.
But
that's true. Actually, I didn't think
maybe
about
a
it.
non-issue. Because are there DPCs in Rochester? I'm not sure.
There's
I'm not
a
familiar.
handful. Yeah, a handful of them.
A handful?
Yeah.
Okay. All right. So there's probably people who already know about DPC, but again, they're all still in New York. They're in the same area, so most people still don't realize that that's what's done in other DPCs. Unless they really start going digging around about DPC, they wouldn't know. So, but you're a DO, so again, you've got the OMT, which is something that a lot of people don't do. And the other thing, think about the pain points that those people were talking about, access and time. Those are the biggest things that most people want. And that's very valuable because you know that it's very difficult to access the system, the regular fee-for-service offices, and they don't get the time. So I think that's very valuable right there.
Yeah.
And if people don't understand that, that's okay. Then they're probably not a good fit for you.
Yeah. Yeah.
And you don't need 2,000.
Yeah. Right.
You probably want somewhere in 300 or 400 at the most.
Right.
Very, very most.
Yeah.
So, yeah, it's okay that they don't know that.
And a lot of
They don't know about
people
meds.
in our area have heard of concierge. So, you get are you going concierge? Oh, is that concierge? And it has this, and I'm sure you probably get that, where you are too. It just has this connotation of like nose up in the air and I can't afford. They just kind of write it off sometimes as, oh, this isn't for me. This is concierge. This is for like only the really wealthy people, and that's not me. And so how do you kind of overcome that? No, this is for you. Like this is like affordable concierge. This is like concierge level care, but it's for the everyday person.
Right.
How do you kind of break that misconception?
Some people get very upset and bristly about it. And some people lean into it because the concept is difficult to understand, but people understand concierge, right? So some people will just be like, yeah, I call it concierge. It's not, but I call it concierge because then they don't have to worry about trying to explain the difference.
Mm-hmm.
But sometimes you can describe it, it's kind of like you just said, concierge level care for the everyday person. I mean, that's perfect. It explains it quite well. And so you can just say something like that, or people call it blue collar concierge,
Mm.
concierge for the common people. And yeah, I think that phrase is really quite nice. It really describes it very nicely. So you can just explain, well, it's kind of like it because it's true. I mean, concierge is smaller patient panels, more time.
Right.
It is kind of like it, right?
Yeah.
But it's just the payment is
Mm-hmm.
different. So it's not necessarily a bad thing because it's already understood what it
Okay.
is. So you just kind of have to massage it a little bit. It's just kind of finesse the finer points. I used to kind of get a little bit like, not upset, but just kind of like, it's not concierge.
You're almost like, no,
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 heck
no.
no. No, but now I realize that that's just what people understand. And so kind of go from there.
Yeah,
You take that, start from there, and then try to explain it.
that makes sense. All right. I do have one last one if we have time.
Yeah.
So I initially was going to take like the less risky kind of route of not opting out of Medicare right away. I was going to stay opted in and just do the thing like the wait list thing. And that way I could have like a side gig if I needed to. And then people that I've spoken to that might be interested, and I'll be like, oh, yeah, can I join? And oh, well, do you take Medicare? And I've had a few patients be like, oh, my dad would love this, but oh, no, but he's on Medicare. And it seemed like it was almost like a barrier to a lot of people. When I really thought about it, I don't think a lot of them will come back in maybe 6 months and be like, now I can sign up. And so now I'm thinking maybe I should just opt out right away, and then that way when I move, I mean, I already have a pretty large established panel who I think a decent number may actually want to follow me, and I think that opting out early might actually be a potentially a better option, so I'm not putting like a barrier there. um
Mm-hmm.
but yeah, it also kind of seems okay, I don't have a backup plan. It's just
Yeah.
diving in. And I don't know, I know that's kind of just like a personal decision probably, but just curious on your opinion there.
Yeah, it's difficult. And again, you'll get kind of opposing viewpoints about this, but financially it's very understandable. If you don't have a lot of runway and you feel like, okay, especially if you were starting out from zero, which you're
Zero.
not,
Yeah.
which is great.
Mm-hmm.
If you're starting out from zero, you may want to consider that so that you could have that side gig and you just kind of hold off on taking any Medicare patients. But Rochester's a good sized city.
Mm-hmm.
There's plenty of people.
Yeah.
And you don't need a ton,
I don't
right?
need a ton.
You
I
just
know.
want 200 to 300. So
Yeah.
odds are,
Like
yeah,
if,
you're
yeah,
gonna find
if
those
like
people
10% of
that
my
value it.
patients follow me, I do almost will. So, yeah.
Right. Yeah. So 5 to 10% is a pretty good average, and it
Oh,
seems
really?
to really
Okay.
work out. 5 to 10% of your current patients will follow you.
Okay.
Most of the time, it works out to be about that.
Okay. Yeah.
Yeah. So you may have a pretty good panel
That helps
starting
actually a
out.
lot.
But yeah, if you don't opt out of Medicare and you are working a side gig, you could look at it as you're not going all in and you're not focusing because you're doing this other side gig. So that's
Yeah.
taking you away from promoting your practice, from
Yeah.
networking, from trying to grow it. So there is that.
True.
But then you also need finances. So, but one way to look at it is if you have your side gig and then you have your DPC. But as your DPC grows, you shrink this.
Mm-hmm.
Don't just hold on to it, right?
The side
Because
gig, right? Yeah.
you feel like you need the whole 20 hours or whatever. Start adjusting if you can. And if it gets to a point where they're like, no, you can't just work 8 hours, then that's time to go. The thing about having or opting out of Medicare first, and even if you don't have a lot of patients initially, that time you can really use that to network, to talk to referral sources, get out in the community,
Yeah.
trying to get new patients because no one's going to sell it better than you would.
Right.
And if you are working your other job,
Right.
that puts pressure on that time. You don't
And
have
I'm doing
that
what I'm
time.
doing now, which is actually really difficult. It's working my full-time, my fee-for-service job and trying to
Right.
do this
Trying
on
to
my
start.
off time. It's like, it's a lot. Yeah. So, okay. That is really
Yeah.
helpful.
I will say I'm trying to think of how many, probably over half of my patients are Medicare. And the thing that they really care about is that they can get in, they can get an answer, they have time to talk to me. And you were asking about the value, what kind of value? I mean, that's huge to them.
Yeah.
I mean, to anyone else too, but particularly to my Medicare patients because they grew up, a lot of them grew up with the town doctor,
Right.
the family doctor who would come to your house, and they've seen the changes in medicine, and they see how terrible it is now, and they want what they had before, which is understandable. So, and plus they have, just odds are, if you're on Medicare, you have more medical issues, and it does require time, and so that's what most of them tell me that they like, is that they get an answer when they call. We answer their questions. They're able to get in, and that's good enough for them.
Yeah, that's really good. Yeah. Wow. Okay. All right. You've convinced me.
Yes, yeah, it'll get here. So yeah, try to build up your email list.
Yeah. Hopefully by then I'll have hopefully launched my website. It'll be planteddpc.com. So
That's awesome. Well, thank you for sharing. I appreciate you putting yourself out there because this is hard.
yeah,
It's
I've
hard.
definitely
We don't learn how to do this.
Yeah, definitely never done this before. Thank you for having me on. This was such a fun
Absolutely.
experience. And thank you for all the coaching.
Thanks again to my guest today, Dr. Sandra Koehn, and wishing her best of luck as she opens her DPC practice in just a few months. And one last reminder about the DPC Women Connect event that's happening in February in Hickory, North Carolina. It is an intentionally small group of women gathering to discuss DPC, create connection and community and support for women who are just starting their direct primary care practices or have opened up in the past 6 months or so. If you've been thinking about DPC or looking for support from other women who are doing the same work as you, I'd love to have you in the room. Details are in the show notes below. Thanks again for listening, and I will see you again on the next episode.
Thank you for listening to DPC Life. If today's conversation inspired you, hit follow, leave a review, and share it with a friend who's ready for change. Remember, wherever you are in the journey, your DPC family has your back. Until next time, keep building a practice and a life that truly fits you. This show is brought to you by DPC Ads and Minutes and Harmony Ops Health, helping independent doctors like you grow and thrive.